So I will just introduce to you a very, very important person, part of the Unicorn Foundation, our net nurse, Kate Wakelin, who many of you may have spoken with. Kate is a registered nurse and with a graduate diploma in psycho-oncology. She has been caring for people affected by cancer for over 20 years, and she's been with the Unicorn Foundation for the past year. So I'm sorry, Kate, that I might actually make you go faster, because of course I always do.
It's always good. Wow, what an amazing history of passionate clinicians, and I just feel so privileged to have sat in the presence of such passionate, driven people who have just been trying to work so hard to improve the outcomes for people with neuroendocrine tumours. And I think there's so much hope for the future with these people on our team. But I want to take it back to what it's like to be a person living with a NET, because we've talked a lot about the treatments and the therapies and outcomes and graphs and things. But at the end of the day, most of the people sitting here have a NET, or they're sitting beside someone, or they're sitting here for a person who's got a NET. And I wanted to talk about the challenges. I don't need to labour these things. I think most people here have seen lots of graphs with lots of symptoms. But sometimes people have no symptoms, and I think that's actually a really important thing to acknowledge. People who have no carcinoid syndrome symptoms sometimes feel like they're a fraud, because there's no sign or symptom. There's no flushing, there's no heart rate, there's those things, and it can feel like there's actually nothing wrong with them, and yet they look at the scan, it looks like they've been to a paintball competition. So it can really be very difficult to reconcile the image of themselves, feeling in themselves, and then what's going on, that they know is growing in their body. So what we know is that, and Rod alluded to this earlier, most patients see 6 to 7 healthcare professionals over 14 visits before they receive a diagnosis of a neuroendocrine tumour. And we know that delays in diagnosis, we've already talked about that, between 5 and 7 years. And we know that most patients, or certainly over 50%, have disease that's spread from where it started. But we also know that over half of you with a NET in this room will have been misdiagnosed. And I just wondered if we could have a bit of a show of hands of who in here with a NET was diagnosed with something else before they received their actual diagnosis. So irritable bowel, gastritis, anxiety, menopause, asthma. A lot of people got sent to a psychiatrist before they found out they had a tummy full of tumours. So it's pretty tough, and I think that leads to certainly some medical challenges in terms of treating advanced disease. But for the person who's come to this position of finding out they've got these tumours, there's all of that in their background. And Rod was talking about how angry that can be. That can make people feel both at the situation of, oh gosh, I should have got that investigated, but I told my GP about that 6 years ago and they didn't find out. And so there's often a lot of anger and sometimes a real level of mistrust. And so they come to a treatment centre like Peter Mac or, to an oncologist who recognises their disease. And it can be hard to rebuild trust. But we also know that people with rare cancers face unique challenges, and this is more than just neuroendocrine tumours, but we know across the board rare tumours are described later at more advanced stages and harder to treat stages. And treatments for rare cancers, we know they haven't advanced at the same pace as treatments for more common cancers. We've heard about that. We tend to have poorer outcomes. And because of all of those things, the level of social isolation for these patients is really enormous. And if you're diagnosed with breast cancer or bowel cancer or prostate cancer, chances are at your local, Probus group or golf club, there'll be a couple of mates, a couple of people, you'll know someone or they'll know someone who's been through it, and you can go to your local breast cancer support group in, millions of locations around Melbourne, for example. But, for a NET, it can be a lot more isolating. And I talk to a lot of people who've never met anyone who's had a NET before. For people in rural areas, there's even more disadvantage. So we know that people in rural areas, they have later stage of diagnosis. The access to treatment is much more tricky. The access to supportive care is also much more limited. So if you live in Melbourne, you can come and see Erin Kennedy, who's the dietitian here at Peter Mac, who's doing her PhD in dietary management in neuroendocrine tumours. If you live in Mildura, that's much more tough. and economics, so the financial burden of living with a rare cancer if you're living in rural or regional areas. So hard. So in a nutshell, the common issues: delayed diagnosis, high symptom burden, so people with a lot of symptoms. There's a disparity with location, but also with healthcare services. So again, if you happen to be referred to a centre of excellence, if you happen to be referred to an oncologist who's read a journal article about neuroendocrine tumours, that's great, but not everybody is an expert on these things, and sometimes people don't realise they need to see an expert on these things. And then there's the psychosocial impact. So it can feel sometimes like you're on an island or stuck between a rock and a hard place, and very much out there on your own. And sometimes that path can feel very, very wobbly and to a destination of great mystery, and it can feel like you're doing it on your own. So I know you all know about the Unicorn Foundation. I'm going to just brush over this slide, but heaps more of information on our website about this. And what we've had for a while is the Net Patient Support Service. So we're so grateful to receive funding for this position. And further to that, there's a network of support groups in most of the major capital cities. Recently, something you might not be aware of is our financial advisory service. So that's something we didn't have a lot of fanfare about when that was launched, but important to know that people with neuroendocrine tumours have access to free financial advice. To access that, contact me. And referrals, so people who contact our support services can then be linked into a whole network of other services as appropriate. So my role is 3 days a week. I'm generally Monday, Wednesday, Friday. And we run a net nurse phone line or a callback service. Often you'll find that my phone goes to answering service. If you don't leave a message, I'm like, oh, leave a message, send me a text, because sometimes I'm in a meeting or talking to someone else or doing some research for someone else. And if you leave me a message, it means I can definitely get back to you. We also provide support via email or text or Facebook Messenger. We have a Facebook private discussion group that not all of you might be aware of, but there's over 700 people in Australia who've been affected by NETs who are part of that group. It's a fantastic network, a wealth of information and support. This year, as Simone said, we've been doing webinars and more to come on that in 2017. This year, we've also worked very hard on strengthening our support group facilitator network around Australia, and we were really excited to have some of those facilitators workshopping with us this morning. Also, a health professionals network has been in development. So that's just, I guess, about improving access to training and professional development for nurses and allied health who might be sprinkled around the country and not able to get that sort of information otherwise. And then face-to-face forums as well, like this one. The sorts of questions that come through to me via the line or via the other sources are, well, what's a NET and what's the difference between that and a carcinoid, and is that cancer? Am I seeing the best doctor? And you can read through the list, but I think the one in bold, which for a lot of people, it's sometimes the elephant in the room, is how do I live with this uncertainty? I'm told that I've got pancreatic cancer. I consulted Dr. Google. That didn't tell me any good news. But another doctor said, I don't really have cancer. It's not really a real cancer. You know, so there's this huge range, and in between somewhere will be my future. And I don't know what it's going to hold. And that's tremendously challenging. Not to mention not being able to leave the house because of diarrhoea. So where have we been up to in 2016? We've had a really busy year. Simone talked about the booklets, the webinars. We've been working a lot with Cancer Council this year on, I guess, not reinventing the wheel. We were really, actually last night Leslie spoke at our cocktail party and said that when she was diagnosed with a pancreatic neuroendocrine tumour, she rang the Cancer Council. They didn't have a peer support volunteer who had survived pancreatic cancer who could then support her through her experience. I'm really thrilled to say that now you can call the Cancer Council and be connected over the phone with someone who survived a neuroendocrine tumour or someone who is keeping on with the journey with neuroendocrine tumours, because we know that this is often a very open-ended situation. So we've got 5 volunteers. We've got people who have had small bowel, lung, pancreatic, and a new volunteer just this last week who had an appendiceal NET. So this is really exciting. So people who contact me, even if they live 4 hours drive from their local support group, I can still connect them with someone who's been through it. Something that we haven't mentioned very much is our consumer advisory group, and such an important, vital part of our network in informing the way our services, our research, our advocacy our awareness. So that's really exciting too. So in the pipeline, 2017, it's going to be a busy year. One of the things that's imminent is the launch of a multilingual service for our support services. So we do well when people speak English, but I don't speak any other languages. So we'll soon have an interpreter service linked to the Net Nurse line, which will be exciting. We're also developing up a series of downloadable fact sheets for someone who's not ready to plough through the booklet, which has got such great comprehensive information, but it can be a bit overwhelming at times, and sometimes you just want to bite. So that's something we're working on. We're also working on strengthening our support group network in rural networks, so providing some informal coffee catch-ups for people who don't live in the major metropolitan centres. Also the use of real-time groups, so we've done some online chat. We're looking to extend that in the following 12 months. So, and it might, we're going to think outside the square. It might be Skype, it might be phone, it might be, online chat, or, we're not sure. Increasing our education for health professionals is also on the agenda. Looking at survivorship care planning, so when someone finishes up treatment at a cancer centre, what information they're given about what symptoms to look for, what sort of scans they need to have down the track, what sort of care they need. And working internationally with our partners in New Zealand and Canada and Europe and beyond. So it's been a year for me working in this role, and it's just been fantastic and so illuminating. I've been so inspired by not only the people who are living with NETs, but the clinicians who are so passionate. But I had some pearls, I had some things that I've learnt over the last 12 months that I wanted to share with you. The first thing is be your own advocate. Find out as much as you can about your condition. Something my doctor said to me about my daughter, who was diagnosed not with a NET but a rare chronic condition, was that very soon you'll know more than I do about this condition. So aim to know more than your GP about your condition. You will need to educate them. Seek a second opinion, and this is vital, even if it's just to confirm the approach of the oncologist who you're being treated under. Our oncologist network in Australia, they're so fabulous about collaborating. So often, having an opinion from a multidisciplinary team and then satelliting back to your local oncologist can be a really effective way of managing your treatment. A little one, but investigate home injection services if you're on somatostatin analogues. A lot of doctors aren't referring to those, and it means that you don't have to leave your home for your injections. I've talked about build and educate your healthcare team. Beware Dr. Google, just don't go there. Give feedback. And just a situation recently in a major hospital, and I'm not going to name, but a whole stack of people were grumbling on Facebook about long waiting times and not being seen and turning up for an appointment that wasn't there. And actually, we were able to facilitate that feedback to be provided back to the hospital. They didn't know they had a problem, and they're so keen to work with this group of patients to get it better. If you're not having a good experience, the hospital or the doctor, they might not realise unless you say something, and there's always a constructive way of providing that feedback. And the last one is connect. Connect with us, connect with each other. You don't have to do this on your own. And I guess our aim is to turn that little kind of wobbly draw, suspension bridge to something that feels a lot more solid and a lot more evidence-based, and with a true destination, with a destination in mind. And I guess not doing it on your own is really important. So thanks.